I wonder if you could sort of ground the conversation by sharing some insights on the unique challenges menopausal individuals might face in terms of urological health and how your expertise as a urologist addresses these challenges.
Yes. Well, thank you so much for having me. I'm so happy to be here and talk about a topic that I love talking about is menopause and life and aging and what
Yeah.
happens to your urologic health when it happens. Because menopause is one of those things that, like taxes, is inevitable. You have to go through it if you live long enough.
Tis
Okay?
the season.
Tis the season. And yet, despite the inevitability of it, everyone, if they live long enough, will go through it. There is very limited resources for people to actually access not only the appropriate care, but also the appropriate information about menopause. There's just so much misinformation in the world about menopause and what happens to the aging body and how to keep that aging body healthy. I think there's this really interesting thing. As a urologist that treats all genders, I get to literally compare how people with penises and people with vulvas are treated in the medical system. And there's a lot of, and men, and people with penises, we hold them to quite a standard that has become my standard, which is a pretty high standard of access to quality of life, life-saving care, and also quality of life, making sure that we're going to save your life. We're also going to make sure that the life that you have is good. And then you come over to women's health and vulvar health, and there's a lot of permissive suffering that I've never seen quite like this. As someone that trained as a urologist, predominantly only seeing men, and having this idea of that like everyone should have a standard of care. We know how your body's going to age, we know how your body's going to change, and we have ways to help treat that and guide you through it. And in women, it's just like, yeah, you guys just age and you suffer and it's okay.
Yeah.
Wild. And so kind of very common things that happen to people throughout their urologic health that happens to, again, every single person is that your vulva literally starts to change. So one of the most fascinating things that most people with vulvas go through and don't know that they're going to go through is that their vulva will literally start shrinking and changing and becoming red, raw, inflamed. And the reason for that is the lack of hormones. Hormones get such a bad rap. Hormones are so vital. Hormones are literally what keep us alive and what keep us healthy and what keep us vital and virile and alive. And yet there's just so much fear surrounding hormones, which is just very different than, again, on the men's side. Hormones, we love them, we support them, we celebrate them. Women's health, hormones, they're vilified. But that scary, that fear mongering, all of those things prevents us from getting to the science. And the science shows that your vulva, your bladder, your pelvic floor, your body needs hormones. And people weren't living as long as they are now. And like, how do we support you through your changing life? And so for many people, they will start experiencing issues with urination because your bladder dependent on hormones, not just estrogen, but also testosterone. Your vulva, your vaginal health, it's also dependent on hormones. And also your pelvic floor health, very dependent on hormones. And so when you start stripping back hormones, which happens in menopause, these changes happen, and many people are not prepared. I love telling my teenage patients all the way to my 99-year-old patient, like, this is what's happening to your body, and these are things to look out for, and these are ways that we can help you.